Hey everybody, I'm Dr. Diane Hayden, publisher of Natural Nutmeg and Essential Naples magazines, and you are joining us today for The Path to Healing. We're going to be talking today about brain health and cognitive function. And I'm excited to welcome four of my expert panelists to you today. Dr. Jared Pistoia, he is a licensed naturopathic physician and author who offers a holistic approach to all chronic conditions at Soleil Holistic in Hamden, Connecticut. Dr. Pistoia prioritizes the root cause of illness with a particular focus on psychology, lifestyle, and the relationship between mental health and gastrointestinal disorders. I also have Dr. Pamela Cipriano. She is a board certified nurse practitioner specializing in preventative medicine. She's the owner and CEO of IV Hydration Lounge and Med Spa, where she focuses on personalized weight loss solutions with IV vitamins, vitamin injections, and semaglutide when necessary. Her med spa also offers PRF and radiofrequency microneedling for skin rejuvenation and PRF biofillers for natural volume restoration. Her practice blends advanced treatments with holistic care to support your health. Dr. Brian Ruggiero is a chiropractor, acupuncturist, hypnotherapist, energy worker, and bioenergetic practitioner dedicated to holistic healing. Through these healing hearts, he uncovers and addresses the root causes of symptoms to support the body's natural healing process. And his goal is to help patients experience lasting relief, increased energy, enhanced well being, and a better quality of life. And he practices in Manchester, Connecticut. And Ethan DeFord of the Integrative Alchemy in Guilford, Connecticut, draws from a diverse background to integrate ancient wisdom traditions with modern scientific insights. Built on a framework of mindfulness practices and a very pragmatic, skill based process, he helps people transform their health through holistic manual therapy, health coaching, and relationship coaching, both in private sessions and with small groups. So, welcome everybody, and thank you all for joining us today. So, I'm just going to ask each of our panelists to just give a quick, just minute, 2 minute little introduction of their own on who they are and what they do in their practice. So, Dr. Jared, we'll start with you.
Sure. Yeah, thanks everybody for coming here. As Diane said, I'm a naturopathic physician and author, and I really specialize in root cause medicine. So I really try to figure out what's going on with somebody that's creating their symptoms and how we can kind of shift whatever their lifestyle is currently so that they can stop getting those symptoms. And so it's a deeper level of healing that combines aspects of lifestyle like nutrition and exercise, all together with some medicines as well, like homeopathy, which can really help shift perspectives and just kind of get people on walking a different path, a path of health. And it's very personalized, very individualized. And I've been involved in health and wellness for pretty much my whole life. I mean, more directly with people for the past 15 years, but this has been my passion for pretty much my whole life. So I love what I do, and I love talking about health, and I'm very happy to be here.
Awesome. Thank you so much. Dr. Pamela, how about you?
I'm Dr. Pamela Cipriano. Thank you guys so much for joining us today. I am the president and founder of the Practice of Health and Wellness and the CEO of IV Hydration Lounge. I am a board certified nurse practitioner, and after my doctoral degree, I went back to school for functional medicine to learn more about the root cause. And I feel like that's a really big part that's being missed in the medical community, where we can actually find the root cause of why somebody is suffering from something, and rather than just giving them a medication for a Band-Aid, we can actually figure out how to correct the underlying cause of the illness. And usually just with dietary changes and supplements, you can really lead a much healthier life.
Awesome. Yep. We got a theme going here, the root cause.
Yes.
Dr. Brian, how about you?
Hi, good afternoon. My name is Dr. Brian Ruggiero, and thank you again for having me, for everyone being here, having me on the panel. It's an honor. I'm the owner of Ruggiero Family Chiropractic and Rehab Center in downtown Manchester for the past 20 years. Time flies. With all the different things that I do, chiropractic, acupuncture, hypnotherapy, energy healing, bioenergetic scans, my path has been a varied one in that way by learning all those techniques. So again, it's finding the root cause and being able to have more tools in the chest to be able to help people out. I feel like it's all about balance and finding balance, especially with all the toxins that come in physically, energetically, emotionally. And yes, thank you again for having me here.
Awesome. We're glad to have you. And Ethan, how about you?
Hi, me, Ethan DeFord. Thanks for having me. The funny thing is, as much as I love root cause analysis, I feel like I want to compliment the other panelists because my personal focus really is on ecological health, just recognizing that all of the dimensions of our life are interactive elements of our health. And so oftentimes it can be helpful to figure out what kind of knocked the system, especially when that disruption persists. But a lot of the times, the thing that really brings us more agency for meaningful change in our health and in our lives is recognizing how our system has adapted to those disruptions. Sometimes the disruption persists and sometimes it doesn't. So being able to really get in touch with more dimensions of our life and our health really helps create meaningful change.
I love that. I
Yeah.
love that. Awesome. Well, thank you, everybody. So I'm going to ask each of the panelists to just put in the chat right now their contact info, how any of you who are on the call live or even listening to this as a recording can contact each of them. So if they can just go ahead and put that in the chat when they get a chance, and some of them might be offering some incentives to you guys, so they'll go ahead and put that in as well. So I have a bunch of questions myself that I'm going to ask our panel here. And if any of you that are on the call listening have any questions, please just go ahead and type them right in the chat, and I'll make sure we get to those before we finish up for today. So um, I'm going to start actually with just each of your opinion on how mindset plays a role, because it kind of sent what Ethan had to say. I mean, we could talk a lot about root cause, and I want to get into a lot of things related to gut health and other like diseases that play a role in what's going on in our brain function and cognitive function. But I think that there was something that he just said that kind of just really piqued my interest. I want to know what each of your opinions are on how like mindset plays a role in this, and maybe the way that we think, because we could figure out the root cause and we could take supplements and we could, change our diet, do all of those things, do all kinds of testing. But a lot of me feels like if we don't really have our mindset and our thought process in a right place, does any of that really matter? So I'll let any one of you guys just jump in and take it from there. Give me your opinions on that.
I'm I'm happy to dive in because so one of the two major categories that I work in, I do mindfulness coaching, which is kind of my catch-all for exactly what you're talking about, right? For a long time, we've been sold on this story that somehow our health and our like even our mental health is a product of chemistry, right? That it's just functions going on inside the machine of our body, and that we're essentially just witnessing that, or we're just along for the ride. And the thing that I think is really apparent, if hard to understand, from the culture that we come from, is that it's a two-way street. It's both and. It's not either or, and that the way that we think affects the way that our body functions, and the way that our body functions affects the way that we think, right? So we tend to, I mean, simplest example, right? Stress is something that we're all dealing with, and we know that the way our body responds to stress is by shifting the mode of its operation. But that program was developed when our stressors were surviving tired, right? So the way that our body is used to adapting to that is preparing us to run or to fight. And so we get our heart working harder, we get our lungs opening up so that we can breathe better, and we shut down our digestive system, right? So just the simplest thing of being concerned, being afraid, uh, being in a state of stress, it shifts the way our body functions. And so being able to consciously engage with our state of mind, with our state of emotion, it helps us shift the fundamental functioning of our body. It's not just there's something going on in the background that's making me feel this way. There's life going on here. And the way that I relate to my life will change the way that my body is functioning.
I love that. Yep.
If I can add on to that as well, I'm a very spiritual person and really into the universe as well. So, as he was saying, if we have negative feelings in our mind, it's going to cause negativity in all the cells in our body. But also, if you have negative thoughts, you're putting that out in the universe, you're going to get negative back. So, trying to change your frequency and your vibration to something more positive, even when things are really dire, trying to find the happiness or the rainbow in whatever's going on in your life many times is enough to start turning things around in your life too. So if you put more of a positive outlook out there, you'll get more positive things happening in your life to come back to you.
Yeah, I was just reading this book actually about, and one of the sentences was, with every challenge, even negative challenges, whether that's a health challenge or say a relationship challenge or a money challenge or whatever, there's an opportunity. So every time something may seem to be ending or causing us a lot of stress, there is a beginning, there's an opening, there is something that we can't see right now, but we have to trust that that spirit or whatever you want to call it is guiding us towards something better.
Mhm.
Yeah.
It's that uneasy feeling is when you
Right.
know things are going to be changing for you.
Yep. Yep.
I
Awesome.
find I find getting outside in nature really brings positive energy in. It really helps me, and I talk about that with my patients as well. Try to get outside and fill the cup, and nature really fills the soul. I find, especially when you can feel depleted and not feeling so well or feeling stressed out. Being around water, being around trees, you can really get the energy off of that and feel energized and feel more positive. Power of the earth.
Love it.
Yeah, and I'd like to add some things too. I think mindset's absolutely foundational, especially if you have a positive growth mindset. It's a way of looking at life, and it gives your brain a reason to stay sharp because you're looking for ways to grow every day, ways to evolve every day, ways to keep yourself excited and happy every day. When you have negative thought patterns or you're isolated or maybe you have a lack of hope, all these things kind of close us down and they box us in. They raise cortisol, they raise inflammatory markers. And in contrast to that, when we have things like a sense of purpose at every age, when we have a sense of purpose, when we're cultivating feelings of gratitude and curiosity and involvement in the community, these actually stimulate protective brain chemicals and they support this idea of neuroplasticity, which is kind of like the brain's ability to change and to form new connections. So I think the key factor is that staying in a positive growth mindset will allow you to continue to evolve and will give your brain a reason to stay sharp and to continue to grow.
Yeah. I love that. I love that. And that's interesting what you said about the brain chemicals too. Like I bet a lot of people didn't know that there's actually things going on from a physiological perspective when you're in a positive or like
Mhm.
you said, a growth mindset or feeling gratitude, all of that.
Yeah, I think it basically piggybacks on what everyone else is saying about when you put something positive out, you get something positive back, and that's actually a physiological reaction that happens.
Yeah, that's really cool.
And
Why do we think, or why do each of you think, if you have an opinion on this, that we're seeing such an increase in brain health issues like dementia or Alzheimer's? Is there something going on in our environment, or is it like just the level of stress that people are under? What are you guys' opinions on that?
I think one of the major things is that people are living longer. Age. Age is a big
Interesting.
factor.
Yeah.
We're all living a bit longer. I'm at that 50-year-old mark.
But and to say that though, are you saying that like it's just we're seeing more of it because there's a larger population of people that are older?
I think part of it too is earlier diagnosis and better awareness also with that as we age and how technology becoming more aware in the medical field. And I feel diet in a sedentary lifestyle is not helping the situation. You know, the pandemic was hard,
Right.
and on many and put a lot of stress physically in the body with diet and just not getting out and moving for many. A lot of people, patients that I knew, were afraid to go out and they really stayed inside and watched Netflix and didn't eat proper foods and their immune system just shot down and they were confused by that. So it's really getting the word out there of having a good diet, getting outside and getting fresh air as an important thing for health.
Yeah, yeah, for sure. Anybody else?
Yeah, so I've actually done a lot of research on this, and there is a correlation between the war on drugs and when hemp got pulled into that whole cascade of events, because hemp was actually used in livestock feed. And at that time, there was no need for antibiotics or other ways of trying to keep an animal healthy because hemp has antimicrobial properties. When hemp got pulled into the war on drugs along with marijuana, the farmers had no way of keeping their livestock healthy except for antibiotics and hormone replacement therapy. And because of that alone, that's actually when Alzheimer's disease and dementia increased, along with Parkinson's disease. That's exactly when it happened. And a lot of it is because when you're eating the meat, you're no longer getting the hemp that keeps your brain cells nice and healthy. Now you're getting a lot of antibiotics that actually cause more issues in the body. And I'm not sure if anybody realizes this, but there is no regulations on how many or how much antibiotics can be given to an animal. So not only are we eating the antibiotics, but they're getting so much of it that when they're urinating, it's going into our water system as well. All of those things are also contributing factors for Alzheimer's disease, dementia, Parkinson's disease, even ALS. So the neurological or neurogenic effects really came around when things started changing with the livestock. So I'm a big proponent of always encouraging my patients to eat an organic diet when it comes to animals. So not only are you no longer getting the antibiotics and the hormones, but you're also getting a much healthier animal because they're not under the level of stress that they normally would be in if they're at a commercial farm. Because farmers who own an organic farm are very appreciative of the animals giving their life for their not only their family's table, but also for financial reasons. And so they're all treated really with respect. And when they are slaughtered, they're not slaughtered in derogatory way where they're frightened. It's more more of a relaxing atmosphere if you can say that. They're not in a line where the next cow or the next pig knows that they're the next ones to slaughter. Animals are very smart. So when you're eating from a commercial farm, you're getting all the inflammatory markers, you're getting all of the cortisol levels that the animal carries in their body, and then you end up having all of the health problems that you get because of those inflammatory markers.
So the best thing would be, I think, to buy from a local farm if you can,
Local
if you have one.
organic is best
Right.
thing to do, really is.
Yep. And if someone doesn't, do you have any, if someone has to say shop at Whole Foods or whatever, do you have any recommendations? Like I've heard Bell and Evans is pretty good for, I think they mostly just do chicken, but
Yeah,
um,
well, chicken is actually one of the most abused animals, so organic chicken is definitely, really, really, really recommended. Provided it says organic on it, you can, if it's organic, they're treated well, they're able to roam around, eating grass, they're not eating the oats and things like that that they really can't even digest. Now, provided that it really is organic, that's the only thing. There's a lot of issues if somebody puts an organic on their label and it's not organic, but you still, you never really
yeah,
know
you
what you're
never know.
getting. Exactly. But a local farm would be so much easier to do something like that and know that you're getting what you're paying for.
Right, right. Okay, awesome. Anybody else have a comment?
Yeah, I think those are great points, and I think the broad strokes of it is, it's those are toxic exposures, right? And I think it's the reason why people are getting dementia more frequently and just illnesses in general more frequently, chronic illnesses. It's a multifactorial problem. There's a lot of different reasons. Toxic exposures are definitely one of them, especially with the food supply, with pesticides, herbicides like glyphosate, which is sprayed on wheat. the way that we're raising and treating animals and what that does to their physical health. All that stuff is really important. And then we also have to consider things like radiation from cell phones and the increasing use of technology, how that interplays with our body and affects our cells. We have to think about drug use. So there's all these different things that we're kind of just used to at this point, but they're really contributing to higher rates and more prevalence of chronic illnesses. And that's just one facet of it, right? Just the toxic exposures. Then you have, as Brian said, sedentary lifestyles. People aren't moving as much. They're inside. They're more isolated. Then you have maybe unresolved emotional stress, things that have been kind of ongoing that maybe you haven't connected with or got in touch with. Disconnection from meaningful relationships, especially as we age. And so there's a bunch of different things that go into this. And that's why focusing on the root causes and the true causes of illness is very important, especially right now in this day and age. It's like we're kind of been getting worse and worse, and we need to kind of reel things back in, focus on the basics, and stay focused on the simple things and not get lost in all the science and all these details. Like we have to reconnect with our basic necessities.
Yeah, I love
And
that.
there's really, I mean, that's so well said, Dr. Pistoia.
Thank you.
I don't want to gild that lily too much, but like these are the kind of things that we think about, right? The things that just become everyday toxic exposures, right? Where we are so accustomed to the convenience that I can go to the grocery store and I can grab, a package of chicken breasts. I don't have to think about that too much. That's just easy. If I have to pay too much attention to that, like I can go down this rabbit hole of all the things that I need to be worried about, all of these different potential toxic exposures. And we really like there's so much that we can do with that. And we're each going to choose the ways that we want to focus. But there are so many things that we can access, which are everyday simple things like good relationships, connection with family, spending time in community, spending time in nature. Like these are they're simple, no-brainer kind of things that don't have to be fear motivated. We can really just engage in stuff that we know is healthy, that we know enhances our life. And these things alone can shift stress. They can shift the metabolic state in our system. They can help us maintain more physical health, more mental health, because we're actually engaging with people mentally and emotionally through more of our life. I mean, it's become one of those standard things that we all embrace for some reason, that we're going to work 50 years of our life, maybe doing something that we're not really inspired by because it'll let us pay the bills and support our family. And after 50 years of working and saving and not particularly being happy about our lives, now we're going to finally get the chance to stop all of the busyness, to let down that go, go, go kind of tempo. And look at what happens when we go into retirement. We've put so much of our life and our focus into work as the thing that we need to do, that we come out of it and people get lost. Like they have to, if they're fortunate, they are looking for hobbies, they're looking for new activities to take on, they're taking up more exercise, they're doing more things that are healthy for their life. But for a lot of people, the cultural standard is, well, now I get to flop on the couch and watch TV. Now I get to stop worrying about punching the clock every day. I get to stop worrying about where my next paycheck's going to come from. I can just stop doing things. And there goes our motivation to be active. There goes our intelligent conversation. If we're lucky, we have family that wants to show up and be a part of our lives and bring that kind of quality emotion in. But if we if our family has gone off into the world and we've not maintained those connections, retirement can be a really lonely slowing down and loss of function.
That is a great point. And I think that, one of the big takeaways from this panel today is what happens to people when they retire, because I literally watched that happen to my boyfriend's father. He literally retired and basically slowed down more and more and more until he just was sitting in his recliner every day watching the Golf Channel or, whatever, some game show or whatever. And sure enough, he ends up getting Alzheimer's. And
Mm-hmm.
I know there's a lot of other things that go into, why is it that one person gets it versus another? And we could say it was genetic or there were other things going on. But I'm telling you that I hear this story so many times where people have worked their whole life in one career. And like you said, Ethan, whether it's worse, I think, if they were more unhappy than, fulfilled in it. And now it's like, okay, now I'm just going to do nothing. And that is the absolute worst thing that people can do. You have to stay active. You have to keep your mind active because this is what happens. And you see now all these people in, like dementia care places, probably because that's exactly how the path that they went down.
Like that rolling stone, really.
Mhm.
If it don't continue to move, things are just going to start to solidify. And I've had so many patients that retire, and my first comment to them is congratulations, but make sure you stay
What are you
on
going to do?
schedule. Yeah, make sure you get up every morning at the same time. Whether you're going to the gym or you're volunteering, make sure you're not just sitting home watching television because you're not going to live very long. You stop moving and you stop being active, and everything, all the little weeds that were being kept at bay are going to start climbing and taking over your body.
Right. Which leads me to the question, are these things reversible? Reversible. I think that's what everybody's thinking. Like, oh, well, what happens if I kind of go down this path and I'm diagnosed with one of these diseases? Is this reversible? What do you guys think?
I think if they're caught early, I think they can be in the very least slowed. Is it reversible? Maybe if you catch it very early on, but you really have to be focused on your health to catch things early on. And that's regular check-ins with your practitioner, keeping track of your symptoms and how you feel. So I think that you can reverse a lot of diseases. It's just a matter of how much are you willing to commit to changing your lifestyle. And that's really where the biggest obstacle is, I think. And I think a lot of people are kind of halfway committed sometimes because they realize that, there's some deeper things going on. Maybe it's uncomfortable to address those things. One of the unfortunate things about what's happened in this country over the past 100 years, which I learned studying naturopathy and then writing my first book, In Pursuit of Health, I published some of this information there, is that we transitioned to the current system that we're at medically, where we're relying on drugs. But in those early days, early 1900s into, I would say, the 1930s, we used to have these great facilities where you can go and get lifestyle medicine and as an inpatient, and they would do these treatments with you like sunbathing and air bathing. They would do things like baseball therapy. These are real treatment modalities that they use with mental health patients in these eras. And unfortunately, what happened with medicines became commercialized, and that stuff basically got bought out by big medicine. And so that's why we don't see that here in the States. But if you look at Europe, they still have these wonderful bathhouses and wonderful traditional therapies that really work. And I think that's one of the reasons why health outcomes in Europe are just so much better than here.
Wow, I didn't know that.
Yeah, nobody really knows because it's buried in history.
Yeah,
Hmm.
In
that's wild.
little fact, in 2005, I think we had it was a homeopathic hospital. It was like the last one in the country. Was closed down in 2005. So it actually was around for a while. I think it was established in the early 1900s. It was huge. It's called the Middletown State Homeopathic Hospital. So it was around for a while, but they closed it down due to this funding, I think.
Wow, that's crazy.
I
Anybody
think,
else? Go ahead,
yeah.
Ron.
Oh,
Nope, go ahead.
no, please. After you.
I think diet's one of the most important things when it comes to things to really be aware of when it comes to uh, slowing down the process or reversing the process, especially like you said, early stages. Having an inflammatory diet, having the gut biome, the little happy microbes inside your gut get inflamed and become damaged, just sets up a cascade of problems of that inflammatory process just really sets the process rolling in a bad way of, of not being healthy. So again, avoiding processed meats, soda, alcohol, saturated fats, um, going more towards olive oils and fish oils and green leafy vegetables. Those sorts of things to be mindful of. I'm a big proponent for intermittent fasting as well. And there's studies that say that it can even clean up some of the toxins in the brain or proteins in the brain by setting up a diet that way. I feel diet out of anything is the first thing to be aware of if there's signs of dementia that are starting.
Awesome.
I have
Go ahead, Ethan.
I have two builds. So the scarier thing to say maybe is that if we're looking for reversing these conditions, it may the I guess kind of the bigger focus is not reversing it for the individual, but reversing it for society, right? And it's scary to say that because that's not something that any one of us can do ourselves. It's something that we all need to be contributing to, to make this, thoughtless food consumption not be something that we take for granted, to have the disconnection from nature, something that we're not losing track of. All of these toxic environmental elements, a lot of this is flowing from the world that we're creating, that each of us are contributing to. And so it takes kind of the wealth of all of us wanting to change that, working to change that each in our own little way, that's going to actually help prevent. Because that's kind of my other point is that, right, what's the saying? An ounce of prevention is worth 10 pounds of treatment. That if we're waiting until symptoms start showing up to care about our health, then we're starting really late in the game, right? So even before early detection, we have the ability to do these things that everybody here are recommending, these really simple ways to take care of ourselves, to care for our health.
It is so simple, isn't it? Yeah. And at the same time, I think we can get ourselves into a lifestyle that's unhealthy fairly easily, whether it's stress or, just not paying attention to really what you're eating or alcohol or whatever it might be. And then it's like, oh, it's really hard to get out of. And, we talk about this stuff all the time, like what people should be doing. And yet sometimes, whether it's just a mindset thing or the life you've created for yourself, like if you've created such a busy life for yourself, whether it's your, a really stressful job, your family, trying to keep up with bills and things like that, I see how it could be difficult to get out of. So I wanted to go back to
Can I just add one thing before we move
Yeah,
on?
no, go ahead.
Okay. So I started using this laboratory called Intellix DNA. And what they do is they research your genomes. So it's all about your genomic composition. And it shows you what deficiencies you have when it comes to foods and vitamins. And by correcting those deficiencies, it actually helps to reverse Alzheimer's disease and dementia, provided it's found early enough. So I've had patients come here where they're becoming more forgetful. I do give them the dementia test. They're not 100% correct, but they're not leaning towards complete Alzheimer's disease either. We do the genomics test through Intellix DNA, and it's a simple mouth swab that we send out. And based on the DNA, they're able to see which supplements are actually deficient, and if we give you those supplements, how it's going to correct everything. So far, it's been a really great thing that I started using this because patients are reversing their dementia and their Alzheimer's disease symptoms before it does turn into an actual diagnosis and irreversible problem.
Wow, that's great that you're seeing that. That is awesome.
Yeah.
Yeah.
Diane,
Yeah.
if I could, there was something that you said that really it tweaked something for me. Because when you're talking about mindset and the mindset around health, a lot of the times when I'm seeing clients, they're coming to me because something's going wrong. And the thing that I've started to realize is there are a lot of people who see taking care of themselves, taking care of their health as kind of a hassle that they don't want to put too much energy into.
Yep.
And they feel that way right up until they need help. And then a lot of those people look back and say, oh, I wish I'd started this 20 years sooner.
You're so right.
If we build that mindset to take care of your health today, that it's worth starting before you need it, it's a huge game changer.
Right. Even if you just do one thing, like
One thing.
literally just change one thing, honestly, that's where you start. So I wanted to go back to all of you have mentioned nutrition. And I think, everybody understands, like that we should be eating healthier, that we should be avoiding processed foods and things like that. But I think maybe what we're just starting to learn more about is this really strong connection between gut health and cognitive function. So I wanted to bring that up and have you guys, whoever wants to talk a little bit about that, if they do that in their practice, and just to make people more aware of how strong that connection is, like what is going on in your gut can have a very huge impact on your brain health and cognitive function. So, Jared, I'll start with you because I know you do a lot of that in your practice.
Yeah, absolutely. It's a very naturopathic idea to start with just treating the gut because the gut is seen as the center of the body in naturopathic medicine and the center of the body's health. If you think about it, it's where all of our nutrient distribution takes place. So we kind of need that center of the body to really be working at full capacity to get a full and optimal distribution of nutrients to the rest of the body. Of course, it's just the starting place. Then you have the cardiovascular system and everything else that's involved. But more specifically, the gut and the brain have a connection we recognize now as the gut-brain axis. And the way that that works in a more broad stroke sense is you have this idea of the vagus nerve, which is just a nerve that drops down from the brain. It's kind of just a single nerve that comes all the way down. And that's the nerve transmission right there. So that's communication. And you also have neurotransmitters, which are basically chemicals that regulate mood, energy, pain, that are actually produced predominantly in the gut by the gut microbiome. And so our moods, the way that we feel in general, are actually largely influenced by the microbes that live inside of our gut. And how do these things live? They have a symbiotic relationship with us based on the foods that we're eating. And so the foods that we eat influence the certain particular populations of bacteria in the gut and which ones come up in number. It's like its own ecosystem. So you think about a jungle where you have, lions, tigers, you have all these different animals, and depending on what's in the area, they're all competing for resources. And so if, there's too many tigers, that's going to affect everything else in the ecosystem. And that's the sort of struggle with the microbiome, is trying to keep the right bacteria in the right populations. So most of it comes down to diet. That's like the foundational thing. When the gut microbiome is out of balance, one of the things that we can see is that the gut lining actually becomes compromised. So the gut lining is basically a membrane that is supposed to be structurally sound, so it prevents things that are not digested from coming across and leaking out into the bloodstream. And that's why we call it sometimes leaky gut if you have a compromised gut lining. And what that does, it just creates inflammation and toxicity in a very general sense. And that travels up to the brain. And it can actually act as kind of like a slow leak poison for the brain and disrupt the barrier that's at the brain, which some people may have heard of, which is the blood-brain barrier, kind of similar to the gut barrier. It's very selective in what it wants to come across, even more selective than the gut. And so very broadly, that barrier gets disrupted in the brain as well. And then you have an inflammatory process in the brain. And that's where you get your anxiety, your depression, and your cognitive decline. So that's kind of like the broad general idea of how they're connected.
Awesome. I love that. Anybody else?
I'd like to add,
Yeah, go ahead, Pam.
I was going to say, I'd like to add on to that as well. So there is a gastroenterologist. Her name is Sabine Hazan. She wrote a book called Let's Talk Shit. She is a
Are you serious?
I swear. She is such a great speaker, very jovial. She does a lot of research on feces. So right now, the only time we'll do a fecal transplant is if somebody has C. diff that has failed antibiotic therapy. We'll take feces from a healthy individual and put it into the sick individual, and the bacteria takes over and the C. diff will go away. She's been doing research on fecal transplants for everything from stroke victims, Alzheimer's disease, Parkinson's disease, even autism in children. And what she does is a DNA analysis of the stool of the affected person and then family members. And what she found is the healthiest people in the family have an abundance of bifidobacterium. And so she has taken that bifidobacterium and put it into the child with autism and sees them start showing emotion, start things in their brain start changing. She saw the same thing with Alzheimer's patients and all. So her research is still ongoing at this point. But I do encourage my patients after reading her book and talking to her in person is to get people to start taking probiotics that are high in bifidobacterium. So when we're born, our gut is filled with bifidobacterium. If we're lucky enough to have a mother who breastfeeds us, that bifidobacterium is going to continue to grow. Then once we start eating food with all the preservatives and processed foods and things like that, that bifidobacterium just completely diminishes and disappears. So eating a really healthy, well-balanced diet, especially in the United States, I can't speak for other countries, is difficult. It really is very, very difficult. Unless you're growing your own food and you have your own animals, it's really hard to make sure that what you're eating is really going to be very healthy. But the healthier your diet, the healthier your neurotransmitters are being made in your gut, and the healthier neurotransmitters are going to be used in your brain. So I think that that's another thing is to try and find a probiotic that has bifidobacterium in it.
Great.
I second the probiotics, a good probiotic. Best thing you can do to keep the healthy bacteria in your gut happy and healthy, which then nourishes the supports the all the neurons in your brain and central nervous system.
And you can use you can get testing for that to see which ones you specifically need. So we like to use in our practice in Hamden I use the GI map. There's other tests that you can do to see which kind of species are living inside your gut and to see which ones you actually need. So it's a more personalized way of choosing a probiotic. And then you can also see, well, which foods might also support the growth of those probiotics too. And instead of just relying on the supplements, you can also come in with specialized diet to kind of give them a little bit more of the foundational stuff that they need. So there is really good testing that you can pursue as well for gut microbiome to see what's going on.
That's a great point.
It's funny. It's actually one of my favorite drums to beat, and I don't want to spend too much time beating it. I think we set ourselves up for a problematic relationship with microbes, in that when we discovered them, right, we were like, oh, wow, there's all of these tiny little things floating around, and oh, it turns out that this one we can link to this disease. And so we adopted this strategy of microbes are out to get us, kill them all. And so we started introducing antibiotics, which, helpful for disease, but the excessive use becomes really increasingly dangerous. We use antimicrobial products, antimicrobial soaps. We distribute hand sanitizers. We neutralize everything. And so this works as a strategy only so long as it continues. Basically, it's a scorched earth strategy. We wipe everything out. And in the absence of a healthy ecosystem, anything can come and set up shop. So the challenge is that what we actually want is biodiversity in the gut, on our skin, or in the soil that our food is growing in. We want diversity. The higher the complexity, the more the different species that are all in competition, the more stable the ecosystem becomes, and the more it resists pathogens, either foreign bodies coming in or an imbalance where one of the normal parts of the population gets out of control, out of balance with the others. And so the thing that I recommend for my clients is to be really, really mindful of where you are doing this scorched earth strategy. Where are you just trying to destroy all of the microbes as if that's the thing that's protecting you from the bad guys?
Mm-hmm. Great point.
Yeah, I agree for sure. So I'm going to ask this question, and I know that it is very personalized and individualized based on what you would recommend for somebody, but we mentioned probiotics. Are there any other supplements or even foods that any of you would recommend someone do just from a preventative standpoint?
I personally love turmeric. I'm a big proponent about turmeric, curcumin, with its anti-inflammatory and antioxidant powers that it has. I talk about it all the time because I find it to be quite powerful to really keep the inflammation down. It's just a yellow spice, and you can get it in capsule form, and I've seen it do wonders.
I've heard all great recipes with that too, like something called golden milk.
Beautifully, yes, I've seen that.
Yep.
It's
Yep.
very tasty, very good.
Actually, I have so, and building on what I said, one of my best recommendations is fermented foods, living foods, foods that have lots of bacteria, yeast, things growing in them. For the golden milk recipe, you can actually, if you know where to look, you can find raw cow's milk. If you drink cow's milk, you can get raw milk that hasn't been pasteurized. So it actually comes with in the same way, right? From mother's milk, we get a transfer of healthy bacteria from mom. The similar sort of thing happens when we get raw milk if it is handled well. And one of the things that really it was this defining moment for me in realizing the significance was I had a container of raw unpasteurized milk that had been in the fridge for long enough that it started to get a little concerning. And so we've all had that experience, right, where we open the milk jug and we sniff and we're like, oh yep, no, that's definitely not okay. And the thing that floored me was, like, I could see chunks in it and I was like, okay, well, I have to sniff it just to be sure. It smelled like brie. The
Wow.
raw
Oh,
milk smelled
really?
like brie.
Oh,
The
wow.
the way that we created cheese in the first place was fermenting milk with naturally occurring ecosystems.
Mhm.
When we wipe out all of that, then you get the bacteria that can come in, which is actually toxic, which is pathogenic, which is going to turn it noxious. And our system instinctually recognizes this is dangerous. This smells wrong. But then when we smell something that it just smells like good cheese, like that's the flourishing of a healthy ecosystem.
That's a great point.
So
The
fermented foods.
And intermittent fasting actually is one of the other panelists was discussing will actually help to regulate the microbiome in the gut. Just 16 hours without food can change a lot of different microbials in the body. It's really amazing. My younger son did a lot of research because there's cancer on both sides of our family. So he started doing a 36-hour fast once a week, which was very concerning for me, I have to admit, because he has a very busy life, busy job, and his adventures, expend a lot of energy. And he really got angry with me because I didn't do the research before I gave my opinion, and he was absolutely correct. So, as long as you're keeping yourself well hydrated, you're taking the proper nutrients, intermittent fasting does really show some promising outcomes for a lot of different reasons.
That's awesome. And Pam, can you put in the chat the bacteria that you were talking about?
Sure.
I think yeah, if you could just spell that out, there was a question about that.
I
Anybody
find
else?
with
Yeah, go ahead,
I
Brian.
find with the intermittent fasting, it's easiest for me to start like after dinner sort of thing, and then just kind of just spacing it out, going to sleep, finishing the day, going to sleep, waking up, and then just not going for any food until a certain period of time into the next day. I find starting it in that way was easiest for me, and I talk about with patients if it's something
Mhm.
they're interested in pursuing.
I have a couple of contributions as well in terms of medicines, things that can be used more for the person who comes in and may need some help like rapidly. And so we're talking about inflammation and kind of resolving it from more of a long-term perspective. Two medicines I really like. One of them is directly anti-inflammatory for both the gut and the brain, and it's called Helleborus. It's just a flower. It's known as also colloquially the Christmas rose. And so you can use it orally, and sometimes it's given by subcutaneous injection, but it really can have a rapid effect on cognitive decline. So you can see changes within 1 to 2 weeks just doing either subcutaneous injections a couple times a week or dosing it orally with drops. Works very well. And then more on the back end, something else I like is ginkgo, which enhances the small circulation in the body, the microcirculation. So especially to those far-reaching small crevices in the brain that we may need to get some support to, that can help prevent some of the wearing away of the brain tissue that you can get with the chronic inflammation. So those two things in combination, simple ways medicinally that you can have rapid effects on the brain.
That's great. Thank you guys. I have a question from one of the listeners that I want to get to. So Gigi asks, curious what the panel's thoughts are on colonics and parasitic cleansing. Bad stuff out, good stuff in. So far, we've just heard of good stuff, food, outdoors, moving. I'm curious about your opinions on cleansing.
So I generally get patients with parasitic infections. And so 9 out of 10 times when I send their stool off to a laboratory, it's going to be negative. What I started doing is if they have signs of parasites, I'll prescribe either antiparasitics through herbs, but I have a lot of success with albendazole. So albendazole is a medication here in the United States, but in other countries, it's actually listed with the vitamins. And when taken, if there are parasites in the body, it'll just literally get rid of them. So I had a very thin, 5'8", 120-pound woman with a host of problems. I mean, she has so many different things going on, and she's been so mismanaged in the medical community. And she brought in pictures of her stool that she was told were remnants of capsules from her vitamins, which that didn't even almost make sense to me. So we did do I did put her on albendazole, and her mother came with her to the next visit, and she just said there were literally a bucket of worms that came out of her. So, there are a lot of problems again in this country, in the medical community, where they feel as if you don't go out of our country, you're not going to have parasites, which is not true at all. There's a lot of different ways to get parasites here. And one thing that I should note is my mom's no longer with us, but she had told me when she was younger, when she was school age, they would all get treated for parasites before school started. And that was every single year. I don't know when that stopped, but I think that that would be a really good thing to start again, because some of the neurological and psychiatric illnesses a lot of times are coming from the parasites because the gut is not acting appropriately. So, maybe doing something like a parasite cleanse using herbs would be something that would be beneficial for all age groups at this point, just even once a year to try and clean yourselves out.
I always make a point with my clients that especially colonic in a lot of ways seems like a fairly innocuous thing. I know a lot of people, especially in spiritual communities, will really gravitate to that. This is something special that they can do for their health. But I always, always, always encourage my clients, go see medical professionals like the people on this call to supervise this sort of activity. Don't do this too cavalierly with something that you read off the internet, especially not if you're doing anything, if you're putting additives into your colonic, doing anything like that. Take medical guidance, especially from people who like people on this panel, can guide you well.
Yeah, I have mixed opinions on doing cleanses. I think I generally like to avoid things that are too aggressive. So that's a starting point in terms of your approach. Is if you're going to be super aggressive about it in terms of killing off as much as possible, it kind of goes back to what Ethan was saying before. The role in which parasites have in our health, nobody really knows if they're actually beneficial. Parasitic infections are bad, but we don't really know if parasites are a part of our microbiome, should they be there at all. That's not been discovered yet. So that's why I kind of approach it with caution. And the other thing to keep in mind is that parasites are pretty large microbes. And so the larger microbes actually carry their own microbiome. And so when we kill parasites, they release another host of microbes into your body. So it's like, well, how does that work after that? So it's tricky. And that's why you approach it with caution.
The wolves are scary, but when you kill off all the wolves, it doesn't always get you the results you're hoping for.
Right.
Even if they're eating all of your sheep and chickens? I'm thinking of Yellowstone here.
One of the great concepts is biodynamic farming. I'm not sure if anyone's familiar with this, but it's the idea of, bringing in, if you have a predator on your farm that's, the foxes eating the chickens, it's like, oh, just, shoot the foxes. It's not really the solution to just shoot the fox, because more of them are going to come back. So the idea is to bring in a fox predator to keep the fox population under control. And then there's a whole chain of things that you need to think about with biodynamic farming, because then it's like, okay, now you have another predator. How do you keep that one under control? Well, maybe it's just like a bird or something like that, then you should be all right. But if it's another land mammal, then it may be an issue. But the concept is kind of speaks what Ethan just said. It's like, how can we get things to work more harmoniously with competition without necessarily just killing?
Yep.
Yeah, it's biodiversity, right?
Hmm.
The simpler the system, the more fragile it becomes. If you
Right,
start taking things out of the system, you're making it more fragile.
right. Great point.
I
Awesome.
find, as with everything, it's all balance. Trying to find that balance is so important in any which way.
Yep, exactly. We just have a couple minutes left. Just a comment from Dr. Lindsay. There is data to support that fungal overgrowth could be the result of inflammation versus the cause. Iron is an acute phase reactant that fungal
Hmm.
loves.
Interesting.
Yeah. One, so we have a couple minutes left. I'm going to throw this out there. It's probably going to take way longer than than what we have time for, but maybe you guys could just say a little bit about it. So I've been hearing this. It's been around for a little while. I'm not sure how many people are familiar with the phrase type 3 diabetes. And I've seen actually some research now to say that there's a connection between type 3 diabetes and cognitive decline or dementia or Alzheimer's. Are any of you on the panel familiar with that? And what are your thoughts?
Type 3 diabetes really refers to chronic insulin resistance causing neurodegeneration in the brain. So, do I agree with the term? Not really, because it's not only the brain that gets affected when there's insulin resistance. When you have high insulin levels and your blood sugar is elevated, there are certain chambers in your body that shut down, not allowing blood supply to get to those areas. And it's usually the tiniest of the arterioles, things like the brain, the eyes, the heart, the kidneys, lower extremities like the feet. So I'm not sure why we would need another diabetes, to be honest with you. I think it would be really important to educate people on how to eat properly, decrease their insulin load, decrease their fasting blood sugar, and and keep it that way. And I mean, my doctoral degree was on preventing the progression from prediabetes to diabetes mellitus. And I remember being 15 years old when my dad was diagnosed with diabetes, along with his six sisters, all, over the years, and my grandmother on my dad's side of the family. And at 15, I said to my dad, well, if you just changed your diet, you could reverse the diabetes. And I mean, every 15-year-old knows everything anyway. So why people didn't believe me, I have no idea.
Right.
But I don't know how many years later, and I did my research and showed that yes, diet does control diabetes. So with all that huge amount of diabetes in the family, I'm not even close to diabetes. But because when I was 15, I remember thinking, I never want to have to go down that road where I have to think about what I could eat, what I can't eat, if I have to take medication. So I've always been very health conscious from a very young age. And because of that, I exercise all the time. I drink a ton of water. I do everything I can to keep my body healthy. But I think that's really important for people to know is you have complete control over your body and your mind, your brain. It's all connected. I know the medical community likes to decompartmentalize everything, but it's one system. So whatever you do to one thing, it's going to have an effect on another, whether it's good or bad. But diet is going to be the most important thing to try and prevent any insulin resistance or elevated blood sugars. That's my opinion.
Yeah. Awesome. Anybody
I think
else?
that's a great point. I think that I don't think I've ever met a patient with dementia or cognitive decline who, when you interview them and say, "What's your diet like?" It's like a lifelong problem that they've had with diet. Been eating, poorly for their whole life. And so it just seems to be the most common scenario for those patients in particular. And it's like, and they're kind of just like, yeah, I just eat whatever I want. Or, I have, the guy comes in with his wife and she's like, oh, he loves the candy bars, and he's just kind of happy about it. But it's almost always the case that that's the scenario.
Or no vegetables. That was my boyfriend's father's. No nothing
Yeah.
green at all. Meat and
The
potatoes.
anti-green,
Yeah.
anti-green diet.
On that nothing green thing, this is one of the things that I'm fascinated with this theory. There's this recognition that indigestible fiber, right? The whole idea is that we lack the enzymes to break it down, which means it's able to carry all the way through to our gut. And one of these kind of functional theories is that one of the values of that is that it traps things that we can break down and actually protects it from our body so that it can get all the way through to our gut so that the microbes that live there can feed on that. So in the absence of that kind of indigestible fiber, we're more disadvantaging our gut. You know, we're depriving them of additional nutrients.
That's really interesting.
Sugar is so toxic to blood vessel walls, and it is so addictive. And so I'm a proponent again to intermittent fasting to help break those addictions.
Yeah, for sure. Hey, Brian, can I have you, before we finish, can I just have you put your contact info in the chat?
Yeah, I've been trying to do that.
Oh,
I've been sending it through, but I don't know. I guess it hasn't gone through yet.
tell
Do
me
you
what
see
it
it? It
is.
has my email and my phone number and the website
Oh, yeah, I
on
think
there.
you were sending it to me as a private message. That's why it didn't
Oh
come through.
no! I'm sorry. Oh man, that's how.
Technology.
Oh
Yeah.
boy.
Do you know how to send it to everyone? Do you know how to do that, Brian? Or you
I
could
will
just,
try.
well, you could just tell me and I can just type it in.
Okay, so it's I'll give you the website. So it's RUGGIERO
Yep.
family FAMILY CHIRO.com.
Okay.
Everybody messes up the I and the E. It's the I before E except after C for Ruggiero.
Yep.
It's been a lifelong thing.
Okay. And
That's
then
the best way.
okay, so you want people to go to your website.
And then I can give my email as well. It's drbrianmanchester@gmail.com. Just DRBRIN Manchester@gmail.com. And people are welcome to call and set up an appointment to even just have a telephone conversation and see how I can help.
Great. That's awesome. Well, I want to thank all of you for hopping on and listening, and I want to thank all of you on my expert panel. This has been awesome, awesome information, very fascinating. We'll get this recording edited, and it should go out to everybody on the call and our entire email list next week. And that it will include all of the expert panels, contact info, and ways that you guys can get a hold of them. So thank you guys all, and thank you to my panel.